Welcome to this explainer from the team at Westminster Multispecialty Clinic. Today, we're diving straight into why the summer gym rush so often leads to injury and exactly how our medical educators and physiotherapy specialists can help you train a whole lot smarter. It's a seasonal phenomenon we see every single year, and honestly, understanding the biology behind it can save you months of frustration. As medical professionals, we like to keep things organized. So our agenda today is going to track the typical patient journey. We'll start with a summer fitness gap, move right into why injuries happen so fast, identify the most common gym injuries we see, outline how to return to training safely, and finally, talk about when it's time to actually seek physiotherapy. Section 1. The summer fitness gap. At Westminster Multispecialty Clinic, what we see with patients is this incredibly distinct and completely predictable physiological shift. From October through April, people are outside, right? They're running, cycling, building up this really robust baseline of fitness. But then the intense summer heat hits. Everyone migrates into these packed indoor gyms, routines just totally break down, and overall activity drops off a cliff. Clinically, we call this the fitness gap, and it is a highly vulnerable window. Because by the time June rolls around, a lot of our patients have pretty much stopped exercising entirely for 6 to 8 weeks. Then they step right back into the gym expecting everything to be exactly how they left it. That brings us to Section 2, why injuries happen fast. We treat a severe mismatch daily in the clinic. It's a clash between expectations and biological reality. Patients fully expect their bodies to perform at their peak March levels, but the reality is severe deconditioning. Cardiovascular fitness, muscular strength, joint stability, they all drop rapidly when training stops. So you're essentially asking a deconditioned body to perform at a level it simply no longer supports. And a major complicating factor our team sees here is definitely psychological. It's the intense urge to make up for lost time, especially in Dubai's high-output gym culture. People just jump straight back into heavy weights and skip their rest days. The mindset is sprinting, but the body's tissues, they're barely ready for a walk. Section 3, most common gym injuries. So what actually happens when a suddenly deconditioned body meets this high-intensity mindset? Well, injuries don't just happen randomly. They cluster. Our physiotherapy service consistently treats vulnerable rotator cuffs from people returning to heavy pressing way too fast. We see massive spikes in strained lower backs from deadlifts and squats, irritated knees from rapid volume increases, and overloaded tendons right across the board. This clustering comes down to something called tendon adaptation. This is a crucial physiological fact we explain to all our patients. Your tendon tissue adapts and strengthens much, much slower than your muscles do. So, while your muscles might feel totally fine to handle that heavy lift again, your tendons are quietly lagging behind, which makes them highly vulnerable when heavy loads are reintroduced too aggressively. All right, Section 4. Returning to training safely. Thankfully, pretty much all the injuries we just talked about are highly avoidable if you follow the safe return principles our specialists recommend. To stay out of our treatment rooms, our team has one foundational rule. You absolutely have to reduce your weights by 20 to 30% for the first 2 weeks. Please do not try to just pick up right where you left off. We advise our patients to follow a really specific phased protocol here. First, as we just said, drop the weight. Second, prioritize your mobility and muscle activation before loading the body heavily. Third, strictly cap your training volume increases at no more than 10% per week. And finally, take your rest days incredibly seriously. Our physiotherapists also stress the importance of the 48-hour window. You need to pay close attention to how your body responds in the critical 24 to 48 hours after a session, not just how pumped you feel while you're actually lifting. Your recovery during this window is literally your best indicator of whether you're pushing too hard. Which brings us to Section 5, when to seek physiotherapy. Even with the best intentions, injuries can happen. And when symptoms do pop up, the single most common question we get asked in the clinic is this: am I just experiencing normal muscle soreness, or is this an actual structural injury that needs professional attention? We actually teach our patients how to read these exact signals. If you've got generalized, aching muscles that resolve within 48 hours, that's just normal soreness. Rest up, modify your training, and you're good. But if you're experiencing sharp pain, if a joint is swelling, or if you have discomfort that persists well beyond that 48-hour window, like a shoulder that just constantly aches through a pressing movement, that's a structural injury, and that absolutely warrants a proper clinical assessment. If you do hit that point, our specialists at Westminster Multispecialty Clinic over in Dubai Healthcare City are here for you. We use precise clinical assessments to identify exactly what's driving the problem at a tissue level. We don't guess. We distinguish the exact nature of the injury and design custom, targeted rehab plans so you can get back to training safely without repeating the same injury cycle over and over. As we always tell our patients, waiting a few days to see if a minor ache settles down on its own, that's fine. But waiting for months, ignoring the warning signs while continuing to train through active pain, that is rarely the right call. It usually just turns a minor setback into a major, complex rehabilitation process. We really want you to enjoy your summer training and stay active. But as you head into the gym this week, I want to leave you with this to think about. Are you genuinely training smarter right now to maintain your fitness? Or are you letting ego take the wheel, pushing too hard, and just setting yourself up for an injury that's going to sideline you exactly when Dubai's beautiful outdoor weather returns this October? Train smart, listen to your body, and remember, if you need us, the team at Westminster Multispecialty Clinic is always here to help.